Welcome to Prevention is Now. I'm Deb Bonner, preventionist and community advocate for Prairie Center Against Sexual Assault in Springfield, Illinois. Sexual violence affects everyone. However, some populations are at higher risks than others. Within the LGBTQ community, transgender people and bisexual women face the most alarming rates of sexual violence. Data from the CDC's National Intimate Partner in Sexual Violence Survey back in 2010 found that 61% of bisexual women experience rape, physical violence, or stalking by an intimate partner, compared to just 35% of straight women. 46% of bisexual women have been raped, compared to 17% of straight women. 22% of bisexual women have been raped by an intimate partner, compared to 9% of straight women. And the 2015 U.S. Transgender Survey found that 47% of transgender people are sexually assaulted at some point in their lifetime. Compounding the issue, LGBTQ individuals are less likely to come forward after a sexual assault than non-LGBTQ individuals. And alarmingly, research from the National Coalition Against Violence Project found 85% of victim advocates they surveyed reported having worked with an LGBTQ survivor who was denied services simply because of their sexual orientation or gender identity. Another significant issue is that many of the sexual violence prevention efforts are highly heteronormative and therefore do not even address many of the problems faced by those in the LGBTQ communities. So, how do we create an effective prevention plan for a high-risk, low-reporting population that faces the additional challenges of discrimination? To help us sort through all of this is Jonna Cooley. Jonna has been the executive director for the Phoenix Center here in Springfield, Illinois for 15 years. Its mission is to support Central Illinois' LGBTQ community with programming for promoting equality, health and well-being, and social and educational growth. She also has over 30 years in social services, has a master's degree in counseling and a PhD in psychology, and Jonna is also a retired adjunct associate professor at the University of Illinois Springfield. So Jonna, welcome.
Thank you.
Now, I think before we can start talking about risks and other issues, we really need to understand the populations and the people we're talking about. For example, there is this tendency from some of those who are straight to consider gay or lesbian or bisexual or transgender or queer individuals essentially all the same, just kind of put everybody in one group. But these are very dynamically different populations. So can you explain some of the differences among the populations and why a one-size-fits-all approach to prevention isn't really going to work?
Yeah, I think that like with any population, we can't one-size-fits-all anyone. I mean, even if we look at straight people in general, people are different. I mean, everybody has histories and they respond to trauma and experiences differently. But I think one of the main things to think about is that we see a lot of research that says the LGBT community, and the reality is that it's really doing a disservice to every letter in that acronym. Because when we say this statistic applies to the LGBT community, we're talking about lesbians, who are women who are attracted to women. We're talking about men, gay men who are attracted to other men, bisexual people who are attracted to both men and women, and then transgender people. The issue is specifically related to gender identity. And on top of having a gender identity that is different than their biological sex, they may or may not be gay or lesbian. So to particularly put the transgender issues in with the acronym really skews whatever it is that we're talking about. So I think we have to look at each of those populations separately. Each group has, just on the surface, has their own set of, issues and independent struggles that come along. And I think, for example, struggles that a transgender person has, maybe a lesbian, for example, had those struggles 20 years ago. The transgender population is in a very different place in our society than gay and lesbian people are. So I think the progress is happening, but it's happening at a much slower pace.
Now, the CDC has identified various risk factors that can increase the likelihood of perpetration or victimization. Things like drug and alcohol use and abuse, poverty and homelessness, prior abuse, just to name a few. So what are some of the most significant risk factors facing those who are within the LGBTQ populations? Knowing, again, that we're probably talking differences with the different sets.
Absolutely. But I think if we look at the population as a whole, one thing that we can talk about is the fact that because LGBTQ people are a minority and a marginalized population, there is a disproportionate number of people that are homeless And as we find with a lot of homeless individuals, drug and alcohol use is higher, the risks for victimization is higher. And then when we take that into consideration with the fact that there is significant medical disparities within the LGBT community, so not only are people seeing more, not only are we seeing more drug and alcohol use and other chronic illnesses that people are not getting treated for because maybe they've had a bad experience with a medical provider, or because they are afraid to disclose their sexual orientation or their gender identity. So I think that all just kind of piles on top of each other to create these risks. And the risks can be, it may start with the trauma, but then I may not get services for that trauma, and that trauma then may lead to depression, it may lead to anxiety, and so it's just like all this just kind of piles on top of each other. So I think that the risks are there, and I think the foundation of a lot of these risks are the fact that LGBT people from a very early age, most people experience some level verbal, emotional, sexual, physical violence because of who they are. And they are minimized as individuals. They are many times ostracized by their families. They're called names. They are become targets for victimization for many people. And so I think that there's a lot of built-in bias and built-in prejudice that leads to a lot of that victimization.
I think one of the most heartbreaking things I ever heard was on one of our previous editions of Prevention Is Now, when we were talking about sex trafficking. And the guest I was speaking with was talking about how teenage LGBTQ individuals find themselves homeless because they come out and then their family throws them out on the street. And I can't understand how you could do that to your own child. But I mean, I don't think anybody really thinks about the kind of struggles that these kids are really facing.
It is a struggle. And, I always say I grew up in the went to middle school and high school in the 70s, and it was a very different time. I grew up in a small community here in Central Illinois. People didn't talk about being gay and lesbian, and being a lesbian myself, I really found that it was a struggle. I heard a lot of negative messages around me, and you just felt like you didn't have a place in society. And while things are so much better now, that still happens. That still happens within religious communities. It still happens within small communities and farm communities, and it still happens in Springfield communities, certainly. So it is unfortunate that a lot of parents, one day love their kids and the next day they don't because they've come out as gay or lesbian or transgender, when in fact that's just one little piece of who their child is. And so I think a lot of that comes out of just a lack of understanding and having adequate information on what that really means.
I was attending a seminar a while back, and the woman who was presenting is a woman of color. And one of the interesting things that she said is that growing up, because she had been marginalized because of the color of her skin, and she lived in a very white area in New England. And she said, so when her sexual assault happened, it seemed almost inevitable to her because she had been treated so badly by kids in school, by the faculty who never stood up for her.
Yeah.
Do you think that that's kind of some of the same struggles that LGBT people are dealing with as well?
Absolutely. I absolutely do believe that. And I think it just depends on where you are and what your support system is. I mean, just think about the fact that if you're an LGBT person, a child, a teenager, a young adult, and you tell your parents and they're supportive, and then you go to school and then there's harassment and bullying and things like that, you have somebody to go home to, or if you have friends at school and teachers who care, then, if home life isn't supported, then you have someone. But there are so many kids that have neither. And so, you were talking about the person saying that they thought sexual assault was inevitable. I think that a lot of gay and lesbian and transgender individuals feel that certainly bullying is inevitable. Certainly discrimination is inevitable. And I think for a lot of transgender people, particularly trans women of color, I think the same thing. They feel that sexual or some type of victimization is inevitable.
Now, we know sexual violence is not about sex. It's about power and oppressing another person. So given the amount of discrimination that the LGBTQ community faces, are we seeing sexual violence used more as a hate crime than we might see it used in other populations?
I certainly think that happens. I mean, every year in November, we have Transgender Day of Remembrance. Why do we even need that day? I mean, the day is specifically to make people aware of the level of victimization that is happening to the transgender community. And looking at the fact that every year, even in this country, we have 30 and 40 trans individuals who are murdered, certainly out of hate, of not having acceptance from their community. And so I think that we certainly see that. I also think that there's probably, like with any other type of sexual assault and victimization, there's probably so much that goes on within the LGBT community as far as sexual violence that is unreported. We probably can't even wrap our heads around it, and there's a lot of repercussions for people to come out who have been victimized. But I think that's even more so the case with people who are gay and lesbian or transgender.
And one of the challenges for prevention efforts in sexual violence prevention is the lack of survivors coming forward. And we know assaults happen far more often than the reports would indicate. And there's lots of different reasons that survivors don't come forward. Shame and embarrassment, afraid of being victim blamed, or not even being believed to begin with. But there are obstacles to someone who is gay or lesbian or bi or transsexual faces that others don't. Can you explain what some of these obstacles are and what we can do to help minimize them so they do feel more able to come forward and report?
Yeah, I think that a big part of this is just what you just said. A lot of it comes out of shame and embarrassment, and people don't want to report. But for people who are gay or lesbian or bi or transgender, I think that a big part of it is that there is fear in what it will mean for them as an individual if they make this report. So for example, if I am a lesbian woman and I'm sexually assaulted by a man and I report this, or I'm sexually assaulted by another woman, if I report this, who's going to find out that I'm a lesbian? Who's going to find out that I have been sexually assaulted, which is obviously a concern for anyone. But also, people have this fear that if I go to the hospital and I get treatment, then my employer is going to find out that I ended up having this situation where I had to go, sexually assaulted. I went to the hospital. The police were involved. It's going to be in my insurance records. They think that people will find this information out about them. Just the fear of being outed, I think, is a big part of it. Certainly for transgender people as well. And I think a compounded thing is, how are people going to respond to me? If I'm a gay man and I tell a police officer, hey, I'm a gay man and I've been sexually assaulted or, been in a domestic violence relationship with someone of the same sex, what are they going to do? How are they going to respond? Typically we tend to lump all heterosexual males into one category, thinking that, well, that person's not going to understand me. They're going to make fun of me. They're going to minimize my relationship. Does that happen? Absolutely. But do all males or all police officers feel that way? No. And we are doing what we can to try to educate and train law enforcement and other first responders in making sure that they, have appropriate terminology and ways to better help people who have been victimized. But I think there are certainly obstacles.
And much of the current frustration, I know, with sexual violence prevention efforts is that it is highly heteronormative. You look at the imagery and, a lot of the curriculum that's out there. It's what do we need to include in future prevention plans to make them more inclusive? I mean, is it just about imagery? Is it about language? I know one of my friends who's a preventionist in another area in Illinois, just instead of using the word boyfriend and girlfriend, she was just using the word partner when she was doing her presentation. And actually one of the parents called to complain that she wasn't using a more quote unquote common or appropriate terminology. And something as simple as partner became very problematic. So I'm struggling to come up with ways where we can include everyone and everyone can be protected and understand the information. But there seems to be a huge struggle.
Yeah, I think that, something that you can do with things like that, and I've encountered that myself in doing some, just talking to kids about HIV prevention and talking about sexual orientation and gender identity and things like that. And I think that what I like to do is ask the people I'm talking to, what kinds of terms do you use for relationships that you have. And then they may say partner, significant other, boyfriend, girlfriend, wife, husband, whatever, use those terms. But also, I think it's really important because to talk about the fact that sexual assault and violence against an individual doesn't have to be a stranger. It can be, and it's most likely oftentimes someone who is a friend, a family member, a boyfriend, a partner, or whatever the term is that you use. And so people feel like, well, if I'm in this relationship or I have this relationship, I can't possibly report this. So I think that we certainly have to open the door to say, if you are being victimized, regardless of who it is, you need to report it, and kind of stay away from the notion that this might just be a boyfriend or a girlfriend. But I think that also we have to look at the fact that in order for us to help kids better understand the dynamics of relationships and things like that, we have to do better with sex education. We have to make sure that kids understand, hey, it's okay if you are attracted to someone of the same sex, and if you are, and you have a relationship, all those relationship rules apply. Victimization, equality, all those things within the relationship apply regardless of who that relationship is with. It doesn't change the rules just because you're with someone of the same sex or not. So I think that just opening the door to a broader conversation is the best way to really expand what we're doing with prevention.
It's really sounding like to me that, we talked about, well, what are some of the obstacles for coming forward, and what are some of the risks? I mean, it really is the same right on down the road for anyone who is going to finds themselves as a survivor of sexual violence. The real issue seems to come from discrimination. And I know that there are a lot of experts who say that any sexual prevention plan, and really not even just for LGBTQ, but for any marginalized population, anti-discrimination laws really need to be in place. So are we really looking more at training the support people, the people in the hospitals, the nurses, the doctors, the law enforcement, courts and things like that, just to be able to set aside any biases or discrimination that they may have? That to me is a huge part of it. Because when we look at the fact that people don't report when they don't get the help that they need, whether it's mental health or medical services, does it come down to whether or not, they feel worthy of those services? Sometimes. But many, many, many times it comes down to bad experiences. They had a bad experience with law enforcement. They've had a bad experience with a medical provider or a mental health counselor or whatever the case might be. And I think that you have to take that into consideration with the fact that many LGBT people have devalued themselves. They feel less than. A lot of times, particularly young people will have, all ages really have significant levels of homophobia, internalized homophobia and internalized transphobia where they're not even comfortable with themselves. So I think that the way that we turn that around is to have more support in the community. And the way we have more support in the community is to have people who are responding in a way that is creating that change. So I think a lot of it has to come from those first responders and providers. Well, we're going to start to go ahead and wrap things up. Where can people find out more about supporting the community? Or if you are LGBTQ and you are struggling with some of these issues, where can you find support besides the Phoenix Center, of course? Right. Well, I think that certainly the Phoenix Center here in Springfield, and we also provide services in the surrounding counties in Central Illinois. If you have questions or you need materials or you want a training, we're happy to help with that. But there's a lot of really great websites. We have links to those websites on our website, which is phoenixcenterspringfield.org. And then it just kind of depends on the kind of resources you're looking for. Are you looking for, something as a parent to help educate your children? Are you looking for something as an LGBT person, as a trans person who's looking for specific resources? We have a lot of links on our website, but there is a lot of good information out there on the internet too. So those are some of the best ways to get your information. Unfortunately, other than the Phoenix Center, there's really not a lot going on here in Central and Southern Illinois as far as services. But I will say that, we've been working with SIU Family Practice. They are going to be opening a gender equity clinic that was going to provide medical services
and mental health services specifically for the LGBT community. And so we're making inroads. I know that domestic violence shelters are now providing services to gay men or men in general. I mean, so we are, there's progress. So it's just a matter of, the big thing is education,
Absolutely. And that's what it seems like. All the world's evils, it always boils down to, we just need to be open-minded and we just need to educate ourselves better.
Yeah, exactly.
Well, Jonna, thank you so much for joining us. We will certainly put the link to the Phoenix Center in the description for the show so people can get at it easily. And I do want to remind, if you are LGBTQ and you are a survivor of sexual violence and you need help, obviously Prairie Center can help you with counseling as well. Jonna, thank you so much for joining us today.
Thanks for having me, Deb.
This has been Prevention is Now. I'm Deb Bonner, preventionist and community advocate for Prairie Center Against Sexual Assault. If you would like more information or have questions about this program, you may call our offices at 217-744-2560 or send me an email at dbonner@prairiecasa.org. Prairie Center Against Sexual Assault supports children and adult survivors of sexual violence through counseling and legal and medical advocacy in 11 central Illinois counties. Prairie Center offers coaching boys into men for male high school and college athletes, bringing in the bystander training for college campuses and sexual harassment prevention training for businesses and organizations in our area. Our main office is located in Springfield, Illinois, with satellite offices in Jacksonville and Taylorville, Illinois. And you can find out more about our services at our website at prairiecasa.org. This program is supported by a grant from the Illinois Department of Public Health and the Illinois Coalition Against Sexual Assault. Points of view or opinions contained in this program are those of Prairie Center Against Sexual Assault and our guests, and do not necessarily reflect the official positions or policies of these grantors. Thank you for listening.